Addressing the muscles of the jaw can positively affect your dental occlusion. Let's talk about it. Hi, I'm Katie, a licensed massage therapist, and I specialize in pains in the head, neck, and jaw. I love talking about self-care for this area so much that I've created a series of online video courses so that you can learn how to address these problems at home. I saw this question posed on a TMJ chat board, so let's discuss. Do you ever feel like your bite is slightly off and when you eat it is irritating, but not painful enough to call a dentist because it'll probably fix itself anyway? There is so much potential in this person's question and story around improving their dental occlusion. So if you can relate, pay attention. I'm going to take you to school. I'm pulling in for some of my client stories here as well. What is a dental occlusion or a bite streak? It is how the teeth contact when your upper and lower jaws close. When you want to properly test this, be sitting or standing up straight and looking forward, then gently tap your teeth together. Feel how they contact. Do you strike first and heavy on one side? Maybe the other side can't strike at all, or you have to clench a little bit to get there. Do you mainly hit on one tooth? Usually it'll be like a front corner tooth. Or does it keep changing each time that you tap with no consistency? In this position of whatever you're tapping now is the best dental occlusion for you right now without any dental intervention or muscular intervention. Towards the end of this video, I'll talk about what might be going on if you don't have that consistency with your occlusion. So it's a little the same and a little different. Keep in mind that many of you who have jaw pain have had a lot of dental work or for some reason opt out of dental work. That's okay. You might also have a small jaw or crooked or crowded teeth as well. So working with the muscles can't move those teeth into a better alignment, but I still want you to be curious as to what you can improve. We can only work with what you've got. So I'm going to walk you through Katie step by Katie step how the muscles can change the dental occlusion. We are assuming that all the other joint pieces are healthy and functioning within reason. So remember, I'm a massage therapist, meaning I study and treat muscles and soft tissues. So I'm really looking at this from my scope of practice. All right. Joints are where two or more bones, where they meet and where they have the potential for movement. Joints don't move by themselves. Muscles contract and lengthen. Muscles cross over joints, and when the muscle contracts, we see movement at the joints. When those muscles are too tight and they don't lengthen out, they will pull the bones out of their most aligned place, or they're going to restrict movement at the joints. In your jaw, you might see it as a limited opening or not opening straight. The jaw complex is rather unique because this one funny shaped lower bone, this one is called the mandible. It is part of both the left and the right TMJ joints or TM joints. To have smooth movements, the left and the right joints need to work together synchronous or really close to that synchronous. Next fact, the teeth attach into the maxilla, your very stable upper jawbone, and also in the mandible. And that's the lower jawbone. The mandible shows more motion. If we move the mandible into and out of a better alignment, the teeth will then contact differently. Remember, the muscles move the mandible. So let's put all of these facts in the blender, blend them up, pour them out, and here is what we are going to get. If the muscles influencing the motion at the TMJ are too tight, especially on one side more than the other, they will pull the mandible out of balance, and you will feel that the dental occlusion is now off, and we can say that off is in little air quotes, and or the condyle of the mandible isn't in the ideal position of the joint because the muscles are pulling on the mandible. What can happen to the TMJ or teeth if you stay in this muscularly influenced poor dental occlusion? If you have a bad bite, strike, or occlusion, a few things might happen. You may get wear and tear of the teeth since they're striking poorly, and also they're striking with force when you're eating. You may tend to chew your food only on one side, so particular muscles will overdevelop, keeping you in this same pain patterning, or it's going to worsen. You might not be chewing your food easily and fully because these teeth tools are not lined up properly to bite and grind. So either you aren't enjoying the food you just paid for, or you're going to swallow large chunks of food, which isn't the best for the digestive system to process. An uneven dental occlusion shines a light on the misalignment of the TMJs. So if you're chewing with more force in this misalignment, you might be annoying or pissing off the structure. How do we improve a dental occlusion from a muscular point of view? Be curious and test your dental occlusion before and after the self-work or professional neck and jaw work to see if it's effective. Make sure you're sitting up or standing straight and looking forward when you gently tap your teeth together to try. One way to get improvement is by seeing a massage therapist or a physical therapist trained in advanced TMJ work. And they will address the soft tissues. They'll probably address the neck and the jaw in these. Now, this is not basic training for TMJ advanced work in either profession, so be sure to ask questions of your provider. For clients at my table, we see great results by treating the 4 main muscles that move the jaw. Temporalis externally, then intraorally for masseter, lateral pterygoid, and medial pterygoid. It is helpful to get the other head, neck, and jaw muscles for full relief and balance, but getting all or some of those will improve the muscular component of a poor dental occlusion. Another way is to learn how to do this work yourself. So last spring, I was doing a breakout session at a birthday conference. Yeah, it was a birthday conference. And I was teaching a group on self-relief for their head, neck, and jaw. So in about a 50-minute session, a lot of talking, but some hands-on work for sure, I taught them how to stretch their SCM muscle, which is a neck muscle. Then we did external massage to the temporalis, external masseter, then I passed out gloves. We went intraorally, and everybody learned how to do intraoral masseter work. At the end of only that work, someone came up to me and said, "Katie, I'm a little confused. My teeth fit together better." And I sort of smiled and I'm like, yeah, that's the work. That's the work. And that's what you need to continue doing. So it's very important to keep that consistency when you know that you have a muscular problem with that affects that dental occlusion. So she would need to continuously work on those muscles and, as I'll talk in a minute, address some bad habits of use. And then she'll see some permanent holding. So what if your dental occlusion is consistently inconsistent? What that means is when you try that strike, it is going to change in contact differently each time you give an attempt. In this situation, I see this a few times at my table, and I find that it's very important to relax those tight muscles or the trigger points. That's done with a lot of self-massage and stretching, and then stabilizing those, I'll call them the lazy muscles, the muscles that aren't engaging, because sometimes we have muscles firing too much on one side and not enough on the other. So we're going to have a movement issue there that we see. So working in both of those kind of things, both the lengthening, turning off the trigger points, and asking muscles to engage will bring us back to really respecting the anatomy here so that you can get that dental occlusion to improve and to be consistent. I can support you through my 2 online video courses at Help Head Pain with the muscular side of your dental occlusion issues. headaches, limited range of motion in the neck and the jaw. In those courses, I'll be teaching you self-massage, stretching, stabilization, proper tongue placement to support the jaw and the neck, and a whole lot of habits to look at that might be irritating your muscles, including we'll talk about eating posture and sleeping positions because those are really big influencers of that dental occlusion. You can sign up for a free video lesson from my site as well. Thanks for watching. Like this video, follow me, and find me on Instagram.